So what about the allergic disorders? Allergy is an abnormal adaptive immune response directed against relatively harmless allergens which are derived from environmental and/or dietary substances. The increase of allergic disorders has greatly increased over the past 4 decades in developed countries due to factors such as pollution, dietary changes, lifestyle changes, and less exposure to microbes, resulting in changes to the immune system reliance. Examples of common allergic disorders include allergic dermatitis, eczema, allergic rhinitis, hay fever, allergic atopic asthma, and various food allergies. The main common allergens found in allergic disorders include the house dust mites. They have two main species, the Pteronicinus and the Dermatophagoides farina. The pet hair as well, particularly more from cats, the pollens, the food sources, insects, various stinging insects, drugs, latex, rubber, mold spores. The airborne spore level shows seasonal changes in atmospheric concentration, which are high in summer and autumn, especially in the seasonal countries with the 4 seasons, with continental climate, but vary significantly throughout the year, unlike the pollens. Allergy is an IgE, immunoglobulin E, mediated type 1 hypersensitivity characterized by degranulation of mast cells and basophils. In sensitized individuals, these mast cells and basophils already possess allergen-specific IgE bound to their surface receptor. When cross-linking of adjacent IgE molecules by allergens happens, the activation and granulation of mast cells and basophils is induced, and it results in the release of inflammatory mediators that trigger allergic inflammation, such as mucus secretion, vasodilation, and smooth muscle concentration, which then further contribute to the allergic symptoms. The allergic symptoms may vary from mild allergies, including itchiness, rashes, hay fever, rhinitis, eczema, conjunctivitis, to chronic asthma and severe life-threatening anaphylactic reactions, anaphylaxis. The conventional allergy treatment is to avoid exposure to allergens, or to eliminate allergens as much as possible, and to use symptom-reducing medications. However, avoiding exposure to allergens becomes difficult due to the dispersed allergens in the air that can be easily inhaled by sensitized individuals without any notice or ability to control. When allergens exposure is inevitable, pharmacotherapy is an alternative to ease the allergen-induced symptoms. Common drugs such as antihistamines and anti-leukotrienes are used as antagonists to allergic mediators and block allergic symptoms. In case where the offending allergen is identified, immunotherapy to desensitize the response to targeted allergen is a promising way to treat allergic reactions. Allergen-specific immunotherapy has been proven to be highly effective treatment for allergic disorders, especially allergic respiratory disorders that respond inadequately to conventional therapies. What is the mechanism of the IgE-mediated allergic reaction? ASI is also a promising targeted therapy that has proven to be safe and effective in treatment of allergic disorders such as allergic respiratory disorders and eczema. ASI vaccines modulate the immune system to produce anti-idiotypic antibodies that competitively bind to the cell-bound IgE antibodies and inhibit the release of the chemical mediators that cause allergic reaction. Therefore, ASI plays an important role in the recovery of the correct immune tolerance response in patients with allergic disorders. An allergic reaction requires the sensitization of the specific antigen, which is recognized by naive T and B lymphocytes. During sensitization, the immune system first encounters the antigen, the allergen in this case, and antigen-presenting cells, APC, then recognize it as a foreign antigen. APCs, antigen-presenting cells, then phagocytose the antigen and present it through specific major histocompatibility complex, MHC, class II antigens. The naive T cells recognize the MHC2 antigens on the APCs and induce the differentiation and expansion of T helper cells, also known as Th2 cells, leading, that's the mechanism, it leads to production of the inflammatory interleukins, specifically interleukins 4, 5, and interleukin 13. These interleukins act on naive B cells and promote immunoglobulin class switching to IgE. The IgE antibodies bind to FRI expressed on the mast cells and basophils. The occurrence of repeated exposure to the allergen results in the cross-linkage of FRI-bound IgEs and initiates the degranulation of the allergic mast cells and basophils. The release of histamine and other types of mediators then contributes to the characteristic symptoms of allergy. Let's talk about the mechanism of action of ASI therapy in allergic disorders. The mechanism of action of ASI in allergic disorders is to induce the production of anti-idiotypic antibodies by the collection of autologous blood followed by the addition of the immune adjuvant. Doing so converts the main autoantibodies responsible for allergic reactions, IgE, into harmless immunogens. Once administered back to the patient, the immune system recognizes the immunogens and induces the production of anti-idiotypic antibodies AB2. The anti-idiotypic antibodies competitively bind with IgE, thereby inhibiting the cross-linkage of FRI-bound IgE and consequently preventing the release of chemical mediators which cause allergic reaction. In this way, the ASI vaccines modulate the production of anti-idiotypic antibodies, which can dampen the allergic reaction.